welcome to Indian Union News. Our guest today is Anjalli Sidhu. She is a founder and CEO of Omnistarr Solutions, a healthcare and IT staffing company. She has also a tremendous passion for healthcare as well as for the women empowerment. We are going to hear her story today, how she started her entrepreneurial journey. And before that, she served as a senior executive for many large corporations in the United States. Anjali, welcome to our studio.
Thank you. Thank you so much.
And so nice to meet you.
Thank you. Same here. Same here. It's a pleasure to be here.
So, I am personally interested in knowing about your journey, professional journey. And let us start. When did we start Omnistarr?
So Omnistarr is a newborn baby. We started in Feb of this year. So my journey started in India 2001. When I started with my own company. It was a IT solutions company, and I'm from IT background, so of course we did that. So going forward from there, my husband got an opportunity in US. So didn't want to be there alone. So came here with him and joined the multinational companies here. And lately I was heading as a global vice president for one of the major corporates of US. And then I thought that something is lacking in US because during COVID time, we saw a lot of healthcare deficiencies. We were hearing about it, and a lot of gaps are there. And we were not getting the care. The doctors were missing. The nurses was not there. And till now, we are getting the appointments, 6 months out, 1 year out. So I am here to bridge the gap between the staffing healthcare staff, which is available in different pockets, in India, and we can bring them here. And so we are working with different companies. So with that intention in mind, and certainly my main passion is to empower women and get as many women in the US workforce in different areas, in different segments, and empower them and to earn their own living and stand up on their own. So those are the two things which I am really focused on.
So Anjali, we hear all the time, especially post-COVID, that there's a lot of burnout among physicians, nurses.
Yeah.
It is very difficult to find good doctors, good nurses. And then if you find them, it is very difficult to retain them.
Right.
So what has been your experience in this area?
Very well said. So we are hearing all the time that there's a burnout. People are leaving. Their doctors have taken early retirement. They're coming out of this whole healthcare industry. So what we are doing and experiencing, certainly we are experiencing the same, but we are trying to help these doctors, nurses, and medical staff get all the human element from us who are like employed with us. And we do a lot of activities for them, recreational activities, so that the burnout ratio, whatever they're experiencing, should be reduced. And we give them benefits. And one more thing, we came to know that these staff of nurses and medical assistants and all the technicians, they don't get medical benefits. Being in the medical industry.
How is that possible?
I was so surprised with that. So my company give best benefits to them, make sure they are comfortable, and we are in constant touch with them that how is it going, how is the work coming along, and do you see any challenges and all that. So I am personally involved in the whole of this process of hiring and retaining and engaging with them.
And where is your recruitment pool? Where all these people are coming from?
Very surprising. They are in US right now. And but what's happening is that all the healthcare giants are not able to reach them, or the candidates or the healthcare candidates are not able to approach them. So we are trying to bridge the gap. we are putting our search out and reaching out through our different networks, deep networks, where they can see our, ask for joining these medical hospitals and the clinics and all that. And that's how we are getting right now.
And I'm sure that you must be knowing, since being from India, India also has a huge pool of physicians and doctors and nurses.
Yes.
Who also wants to come to US as well.
Exactly. So we are working right now with the prominent, I don't want to take the name, but we are working with the prominent authorities in Boston area and making a channel between India and US to get them from India to US and making the visa processing easier and all that. We are working with all those organizations right now.
Okay.
So Omnistarr is a healthcare and IT staffing company. And we know that many of the healthcare organizations, hospitals and all, they have their own set vendors and the channels where they get their candidates from. I would really request all of you out there to help us and give us a chance and try our extremely different and out-edged staffing services, where we not only staff but also take care of your staffing needs and solutions if we can do anything about it.